Welcome to the CCRN Mastery, the ultimate study guide for adult critical care nurses. Whether you're striving to elevate your nursing expertise, expand your career opportunities, or achieve your CCRN certification, you've come to the right place. This video is designed to guide you through the core concepts of critical care nursing, offering real-world scenarios, practical strategies, and key insights to help you excel. After each chapter, you'll find a dedicated Q&A session to reinforce your learning. For comprehensive preparation, check the description for access to the Audible version, the free Ultimate Exam Prep Guide, or the Amazon link for the book. Don't forget to like and subscribe for more updates and practice content. Now, let's begin this journey towards CCRN success with your instructor.
In managing high-risk obstetric patients in the ICU, which condition is a leading cause of maternal mortality? A. Gestational diabetes. B. Preeclampsia/eclampsia. C. Anemia. Or D. Infections. The answer is B. Preeclampsia/eclampsia. Number 2. What is the primary goal in the initial treatment of burn patients? A. Wound cleaning. B. Pain management. C. Fluid resuscitation. Or D. Infection prevention. The answer is C. Fluid resuscitation. Number 3. Which assessment is crucial for pediatric patients in an adult ICU? A. Glasgow Coma Scale. B. Pediatric Early Warning Signs, PEWS. C. Adult-Based Sepsis Protocols. Or D. Braden Scale for pressure ulcers. The answer is B. Pediatric Early Warning Signs, PEWS. Number 4. What is the key challenge in caring for pediatric patients in an adult ICU setting? A. Lack of appropriate medical equipment. B. The need for higher medication doses. C. Communication barriers with pediatric patients. Or D. Different disease presentations compared to adults. The answer is D. Different disease presentations compared to adults. Number 5. In trauma patients, which symptom is a common indicator of internal bleeding? A. Hyperthermia. B. Hypertension. C. Tachycardia. Or D. Bradypnea. The answer is C. Tachycardia. Number 6. What is the primary concern in the management of a patient with a severe head trauma? A. Preventing infection. B. Managing pain. C. Reducing intracranial pressure. Or D. Immediate surgical intervention. The answer is C. Reducing intracranial pressure. 7. Which intervention is most critical for a patient with extensive full-thickness burns? A. Immediate skin grafting. B. Aggressive fluid resuscitation. C. Early amputation. Or D. Application of topical antibiotics. The answer is B. Aggressive fluid resuscitation. Number 8. What is the first step in the assessment of a trauma patient according to ATLS guidelines? A. Breathing and ventilation assessment. B. Circulation and hemorrhage control. C. Airway management with cervical spine protection. Or D. Disability neurological status assessment. The answer is C. Airway management with cervical spine protection. Number 9. In a high-risk obstetric patient, which sign is indicative of imminent eclampsia? A. Mild headache. B. Hypertension and proteinuria. C. Sudden weight gain. Or D. Hyperreflexia. The answer is D. Hyperreflexia. Number 10. Which is the key ethical consideration when dealing with pediatric patients in the ICU? A. Informed consent from the parent or guardian. B. The child's right to confidentiality. C. The patient's assent for treatment. Or D. All of the above. The answer is D. All of the above. Number 11. For burn patients, what is the primary reason for administering tetanus prophylaxis? A. To reduce the risk of sepsis. B. To promote wound healing. C. To prevent tetanus infection. Or D. To enhance pain management. The answer is C. To prevent tetanus infection. Number 12. Which of these is an emerging trend in critical care therapy? A. Routine use of invasive monitoring. B. Use of ECMO in severe ARDS cases. C. Decreased use of antibiotics. Or D. Avoidance of mechanical ventilation. The answer is B. Use of ECMO in severe ARDS cases. 13. In trauma care, what is the significance of the golden hour? A. The time needed for complete surgical intervention. B. The first hour after injury, critical for successful outcomes. C. The time it takes for clot formation in bleeding wounds. Or D. The period in which pain management is most effective. The answer is B. The first hour after injury, critical for successful outcomes. 14. What is a common complication in the ICU management of high-risk obstetric patients? A. Gestational diabetes. B. Pulmonary embolism. C. Chronic hypertension. Or D. Urinary tract infections. The answer is B. Pulmonary embolism. 15. What is the main goal in the care of pediatric patients in the adult ICU? A. To minimize the use of sedation. B. To ensure growth and development are on track. C. To provide age-appropriate care and monitoring. D. To prepare for early discharge. The answer is C. To provide age-appropriate care and monitoring. 16. Which factor is crucial in the initial management of trauma patients? A. Rapid fluid replacement. B. Immediate antibiotic therapy. C. Ensuring adequate oxygenation. Or D. Immediate pain relief. The answer is C. Ensuring adequate oxygenation. 17. In the case of a major burn, what is the most common cause of death in the acute phase? A. Infection. B. Hypothermia. C. Fluid loss and shock. Or D. Respiratory failure. The answer is C. Fluid loss and shock. 18. What is a critical consideration when dealing with emerging therapies in critical care? A. Cost effectiveness. B. Ease of use. C. Evidence-based outcomes. Or D. Patient preference. The answer is C. Evidence-based outcomes. 19. In pediatric patients, which symptom is a late sign of shock? A. Tachycardia. B. Hypotension. C. Fever. D. Irritability. The answer is B. Hypotension. 20. For high-risk obstetric patients in the ICU, what is the most effective strategy for managing severe preeclampsia? A. Immediate delivery of the baby. B. Magnesium sulfate administration. C. Bed rest and fluid restriction. Or D. High-dose corticosteroid therapy. The answer is B. Magnesium sulfate administration. Number 21. What is a key component in the initial assessment of a burn patient? A. Check for airway compromise. B. Determine the depth of the burn. C. Estimating the total body surface area, TBSA, burned. Or D. Administering pain medication. The answer is C. Estimating the total body surface area, TBSA, burned. 22. In trauma care, which diagnostic tool is essential for evaluating abdominal injuries? A. X-ray. B. CT scan. C. MRI. D. Ultrasound. The answer is B. CT scan. 23. How does the presence of a pediatric patient in an adult ICU affect the team's approach? A. It requires specialized pediatric equipment. B. It necessitates a more family-centered approach. C. It involves more frequent monitoring. Or D. It demands higher doses of medication. The answer is B. It necessitates a more family-centered approach. 24. What is the most common cause of maternal death in high-risk obstetric patients in the ICU? A. Hemorrhage. B. Infection. C. Cardiac complications. D. Respiratory failure. The answer is A. Hemorrhage. 25. Which treatment is most effective for managing pain in burn patients? A. NSAIDs. B. Opioid analgesics. C. Acetaminophen. Or D. Local anesthetics. The answer is B. Opioid analgesics. 26. In the management of trauma patients, what is the primary reason for early fracture stabilization? A. To allow for early mobilization. B. To reduce the risk of fat embolism. C. To minimize pain. Or D. To prevent chronic disability. The answer is B. To reduce the risk of fat embolism. 27. What is the most critical factor in the care of pediatric patients in an adult ICU? A. Ensuring rapid discharge. B. Maintaining normal growth and development. C. Providing age-appropriate psychological support. D. Administering pediatric-specific medications. The answer is C. Providing age-appropriate psychological support. 28. Which factor is crucial in the decision-making process for emerging therapies in critical care? A. The therapy's popularity. B. The cost of the therapy. C. Patient and family preferences. Or D. Evidence-based practice and research. The answer is D. Evidence-based practice and research. 29. In high-risk obstetric patients, what is a key sign of deteriorating condition? A. Decreased urinary output. B. Mild headache. C. Slight increase in blood pressure. Or D. Occasional dizziness. The answer is A. Decreased urinary output. 30. What is the most important aspect of care for a trauma patient with a spinal cord injury? A. Immediate surgery. B. Steroid administration. C. Stabilization of the spine. D. Aggressive physical therapy. The answer is C. Stabilization of the spine. 31. For burn patients, what is the primary purpose of nutritional support? A. To improve wound healing. B. To prevent weight gain. C. To enhance patient comfort. Or D. To decrease the risk of infection. The answer is A. To improve wound healing. 32. What is the most common complication for pediatric patients in an adult ICU? A. Cardiac arrest. B. Delirium. C. Respiratory distress. Or D. Infection. The answer is B. Delirium. 33. In trauma care, what is the importance of the secondary survey? A. To reassess vital signs. B. To identify less obvious injuries. C. To prepare the patient for surgery. Or D. To administer pain medication. The answer is B. To identify less obvious injuries. Number 34. In high-risk obstetric patients, which medication is commonly used to manage hypertension? A. Magnesium sulfate. B. Labetalol. C. Aspirin. Or D. Insulin. The answer is B. Labetalol. Number 35. What is the primary concern in managing pediatric patients with traumatic injuries in an adult ICU? A. To ensure they receive adult-sized doses of medication. B. Keeping them separated from adult patients. C. Addressing their unique physiological responses to injury. D. Providing them with pediatric-specific medical equipment. The answer is C. Addressing their unique physiological responses to injury. 36. Which of the following is a major challenge in the application of emerging therapies in critical care? A. Obtaining patient consent. B. Training staff in new procedures. C. Insurance coverage for new treatments. Or D. Coordinating care with other departments. The answer is B. Training staff in new procedures. 37. During initial burn care, why is fluid resuscitation critical? A. To prevent hypothermia. B. To manage pain. C. To prevent shock. Or D. To hasten wound healing. The answer is C. To prevent shock. 38. In trauma care, what is the purpose of the damage control surgery approach? A. To perform definitive surgical repair. B. To control bleeding and prevent contamination. C. To reduce the time in the operating room. Or D. To immediately correct all anatomical injuries. The answer is B. To control bleeding and prevent contamination. 39. In high-risk obstetric patients, what is the main purpose of fetal monitoring in the ICU? A. To determine the baby's gender. B. To assess the need for immediate delivery. C. To monitor the baby's growth. Or D. To prepare for cesarean delivery. The answer is B. To assess the need for immediate delivery. For pediatric patients in an adult ICU, what is the most important consideration in medication administration? A. The flavor of oral medications. B. The dosage based on weight and age. C. The color of the medication. Or D. The form of the medication, i.e. liquid or tablet. The answer is B. The dosage based on weight and age. 41. In burn care, what is the significance of early excision and grafting? A. It improves cosmetic outcomes. B. It reduces the risk of infection. C. It decreases the need for pain medication. Or D. It allows for quicker discharge. The answer is B. It reduces the risk of infection. Number 42. What is a critical component in the management of pediatric trauma in the ICU? A. Frequent neurological assessments. B. Routine use of CT scans. C. Parental presence during procedures. Or D. Early introduction of solid food. The answer is A. Frequent neurological assessments. 43. In high-risk obstetric patients, what complication is indicated by a sudden onset of dyspnea and hypoxia? A. Pulmonary embolism. B. Myocardial infarction. C. Amniotic fluid embolism. Or D. Congestive heart failure. The answer is C. Amniotic fluid embolism. 44. How does ECMO, extracorporeal membrane oxygenation, support patients in critical care? A. By enhancing renal function. B. By providing cardiac and respiratory support. C. By improving neurological outcomes. Or D. By accelerating wound healing. The answer is B. By providing cardiac and respiratory support. 45. In trauma care, what is the primary goal of permissive hypotension? A. To reduce the risk of hemorrhage. B. To decrease the need for blood transfusions. C. To prevent hypertension-related complications. Or D. To maintain minimal necessary organ perfusion. The answer is D. To maintain minimal necessary organ perfusion. 46. What is the key factor in the care of pediatric patients with severe burns in an adult ICU? A. Limiting visitors to reduce infection risk. B. Providing age-appropriate pain management. C. Avoiding the use of dressings. Or D. Administering adult doses of antibiotics. The answer is B. Providing age-appropriate pain management. 47. In managing high-risk obstetric patients, why is continuous fetal monitoring important? A. To assess for fetal distress. B. To determine the baby's position. C. To monitor the mother's heart rate. Or D. To prepare for immediate delivery. The answer is A. To assess for fetal distress. 48. What is a major consideration in using emerging therapies like CRRT, continuous renal replacement therapy, in critical care? A. The patient's ability to consent. B. Ensuring 24/7 availability of technical support. C. The therapy's impact on long-term outcomes. Or D. The cost of therapy. The answer is B. Ensuring 24/7 availability of technical support. 49. For pediatric patients in an adult ICU, what is crucial for their psychological well-being? A. Strict bed rest. B. Frequent medical procedures. C. Involvement of child life specialists. Or D. Limited interaction with parents. The answer is C. Involvement of child life specialists. 50. In trauma patients, what is the rationale for early mobilization? A. To enhance muscle strength. B. To prevent deep vein thrombosis. C. To reduce the length of ICU stay. Or D. All of the above. The answer is D. All of the above. 51. How do pressure injuries impact burn patients' recovery in the ICU? A. They lead to increased pain levels. B. They prolong the healing process. C. They increase the risk of infection. Or D. All of the above. The answer is D. All of the above. 52. In high-risk obstetric patients, what is the main purpose of administering corticosteroids? A. To reduce inflammation. B. To enhance fetal lung maturity. C. To control blood sugar levels. Or D. To prevent allergic reactions. The answer is B. To enhance fetal lung maturity. 53. Why is family-centered care important in the management of pediatric patients in an adult ICU? A. It improves family satisfaction. B. It reduces the child's anxiety. C. It enhances the child's recovery. Or D. All of the above. The answer is D. All of the above. Number 54. What is the primary goal in the initial management of a patient with severe trauma? A. To assess the extent of injuries. B. To stabilize vital signs. C. To prepare for surgery. Or D. To administer antibiotics. The answer is B. To stabilize vital signs. 55. In burn care, what is the role of hydrotherapy? A. To provide pain relief. B. To assist in wound debridement. C. To prevent dehydration. Or D. To improve circulation. The answer is B. To assist in wound debridement. 56. What is a key consideration in the care of high-risk obstetric patients regarding medication administration? A. The potential impact on the fetus. B. The preference of the patient. C. The cost of the medication. Or D. The route of administration. The answer is A. The potential impact on the fetus. 57. In trauma care, what is the significance of the platinum 10 minutes? A. The first 10 minutes after arrival in the ICU. B. The initial 10 minutes at the scene of the injury. C. The first 10 minutes of surgery. Or D. The 10 minutes following the secondary survey. The answer is B. The initial 10 minutes at the scene of the injury. 58. How does CRRT benefit patients with acute kidney injury in critical care? A. By rapidly restoring kidney function. B. By allowing slower fluid removal, C. By providing instant pain relief, or D. By eliminating the need for dialysis? The answer is B. By allowing slower fluid removal. 59. What is the primary focus in the nutritional management of pediatric patients in an adult ICU? A. Encouraging self-feeding. B. Meeting caloric and protein needs. C. Limiting sugar intake. Or D. Introducing new foods. The answer is B. Meeting caloric and protein needs. 60. In the management of trauma patients, why is the control of bleeding a top priority? A. To prevent anemia. B. To reduce the need for blood transfusions. C. To prevent hypovolemic shock. Or D. To facilitate quicker wound healing. The answer is C. To prevent hypovolemic shock. 61. What is the most effective strategy for pain management in pediatric burn patients in the ICU? A. Regular administration of NSAIDs. B. Use of opioid analgesics in conjunction with non-pharmacological methods. C. Application of topical anesthetics only. Or D. Avoiding pain medication to prevent dependency. The answer is B. Use of opioid analgesics in conjunction with non-pharmacological methods. 62. In high-risk obstetric patients, what is the key indicator of placental abruption? A. Gradual onset of lower back pain. B. Sudden intense abdominal pain. C. Persistent vomiting. Or D. Increased fetal movement. The answer is B. Sudden intense abdominal pain. 63. What is the primary purpose of using inhaled nitric oxide in critical care of neonates? A. To reduce pulmonary hypertension. B. To improve oxygenation. C. To stimulate lung growth. Or D. To treat respiratory infections. The answer is A. To reduce pulmonary hypertension. 64. In trauma patients, what is the significance of maintaining normothermia? A. To enhance comfort and reduce anxiety. B. To prevent hypothermia-related coagulopathy. C. To accelerate wound healing. Or D. To reduce the risk of infection. The answer is B. To prevent hypothermia-related coagulopathy. 65. For high-risk obstetric patients in the ICU, what is the most significant risk factor for developing HELLP syndrome? A. History of hypertension. B. Advanced maternal age. C. Presence of gestational diabetes. Or D. Prior history of HELLP syndrome or preeclampsia. The answer is D. Prior history of HELLP syndrome or preeclampsia. Number 66. In the management of pediatric patients in an adult ICU, what is the importance of sedation holidays? A. To assess the child's neurological status. B. To reduce the risk of addiction to sedatives. C. To allow for parental interaction. Or D. To facilitate weaning from mechanical ventilation. The answer is A. To assess the child's neurological status. 67. What is the primary consideration in the nutritional management of trauma patients? A. Avoiding overfeeding. B. Providing a high carbohydrate diet. C. Ensuring adequate protein intake. Or D. Minimizing fluid intake. The answer is C. Ensuring adequate protein intake. 68. In high-risk obstetric patients, what is the main complication associated with severe preeclampsia? A. Gestational diabetes. B. Intrauterine growth restriction. C. Eclampsia. Or D. Chronic hypertension. The answer is C. Eclampsia. 69. What is the role of therapeutic hypothermia in the critical care of pediatric patients? A. To treat fever and infections. B. To manage metabolic disorders. C. To reduce neurological damage after cardiac arrest. Or D. To improve surgical outcomes. The answer is C. To reduce neurological damage after cardiac arrest. 70. In burn care, what is the purpose of early enteral nutrition? A. To provide comfort to the patient. B. To prevent gastrointestinal ulcers. C. To support the immune system. Or D. To enhance wound healing. The answer is D. To enhance wound healing. 71. For trauma patients, why is rapid sequence intubation often necessary? A. To facilitate diagnostic procedures. B. To prevent aspiration and secure the airway. C. To administer medications more effectively. Or D. To reduce the risk of spinal cord injury. The answer is B. To prevent aspiration and secure the airway. 72. In managing high-risk obstetric patients, what is the significance of continuous electronic fetal monitoring? A. To monitor the mother's heart rate. B. To assess fetal well-being and detect distress. C. To determine the position of the fetus. Or D. To prepare for emergency delivery. The answer is B. To assess fetal well-being and detect distress. 73. What is the main challenge in the critical care of pediatric patients with congenital heart disease? A. Managing fluid balance. B. Ensuring adequate caloric intake. C. Monitoring for signs of heart failure. Or D. Providing psychological support. The answer is C. Monitoring for signs of heart failure. 74. In trauma care, what is the role of damage control orthopedics? A. To perform definitive surgical repairs of all fractures immediately. B. To stabilize fractures temporarily to allow physiological recovery. C. To avoid surgical intervention in multiply injured patients. Or D. To focus solely on cosmetic outcomes. The answer is B. To stabilize fractures temporarily to allow physiological recovery. 75. For high-risk obstetric patients with cardiac disease, what is a key consideration in their management? A. Limiting fluid intake strictly. B. Closely monitoring cardiac function. C. Administering beta blockers routinely. Or D. Avoiding fetal monitoring. The answer is B. Closely monitoring cardiac function. 76. What is the importance of play therapy for pediatric patients in an adult ICU? A. To encourage physical activity. B. To provide a sense of normalcy and reduce stress. C. To assess the child's developmental level. Or D. To distract the patient during painful procedures. The answer is B. To provide a sense of normalcy and reduce stress. 77. In burn care, why is it important to monitor for signs of sepsis? A. Burn injuries can lead to systemic infections. B. Sepsis can cause hyperglycemia. C. Sepsis is associated with increased scarring. Or D. Sepsis can delay surgical interventions. The answer is A. Burn injuries can lead to systemic infections. 78. How does the presence of a pelvic fracture change the management approach in trauma patients? A. Necessitates immediate surgical intervention. B. It increases the risk of hemorrhage. C. It requires the administration of anticoagulants. Or D. It limits the use of certain pain medications. The answer is B. It increases the risk of hemorrhage. 79. In high-risk obstetric patients, What is the main concern with the use of magnesium sulfate? A. It can cause hyperglycemia. B. It may lead to respiratory depression. C. It increases the risk of uterine rupture. Or D. It can cause fetal bradycardia. The answer is B. It may lead to respiratory depression. 80. What is a crucial aspect in the management of pediatric patients with respiratory distress in an adult ICU? A. Frequent chest x-rays. B. Use of adult-sized ventilator circuits. C. Tailoring intervention strategies to their physiological needs. Or D. Prioritizing oral medications over inhaled therapies. The answer is C. Tailoring ventilation strategies to their physiologic needs. 81. In trauma care, what is the importance of the tertiary survey? A. To reassess and detect missed injuries. B. To plan long-term rehabilitation. C. To prepare for discharge. Or D. To evaluate the patient's response to treatment. The answer is A. To reassess and detect missed injuries. 82. How does the use of bedside ultrasound benefit high-risk obstetric patients in the ICU? A. It allows for non-invasive fetal monitoring. B. It helps in assessing cardiac function. C. It is used for guiding invasive procedures. Or D. All of the above. The answer is D. All of the above. 83. What is the primary challenge in managing pediatric burn patients in an adult ICU? A. Ensuring adequate pain control. B. Preventing infection. C. Managing fluid resuscitation. Or D. Psychological support. The answer is A. Ensuring adequate pain control. 84. In high-risk obstetric patients, what condition is indicated by a sudden drop in platelet count? A. HELLP syndrome. B. Gestational diabetes. C. Preeclampsia. Or D. Placental abruption. The answer is A. HELLP syndrome. 85. For trauma patients with chest injuries, what is a key component of care? A. Frequent change of position. B. Administration of high-flow oxygen. C. Regular chest physiotherapy. Or D. Early and aggressive fluid resuscitation. The answer is C. Regular chest physiotherapy. 86. What is a major consideration in the use of mechanical ventilation for pediatric patients in an adult ICU? A. Using lower tidal volumes than in adults. B. Implementing adult respiratory protocols. C. Minimizing the use of sedation. Or D. Avoiding non-invasive ventilation. The answer is A. Using lower tidal volumes than in adults. 87. In burn care, what is the primary goal of fluid resuscitation using the Parkland formula? A. To provide pain relief. B. To prevent renal failure. C. To maintain adequate urine output. Or D. To prevent hypothermia. The answer is C. To maintain adequate urine output. 88. What is the significance of multidisciplinary team care for high-risk obstetric patients in the ICU? A. It ensures comprehensive care covering all aspects of patient needs. B. It reduces the length of ICU stay. C. It is required for insurance purposes. Or D. It focuses solely on the baby's health. The answer is A. It ensures comprehensive care covering all aspects of patients' needs. 89. In managing pediatric trauma patients, why is injury prevention education important? A. It is a regulatory requirement. B. To reduce the likelihood of recurrent injuries. C. To engage the family in care, or D. To prepare for discharge? The answer is B. To reduce the likelihood of recurrent injuries. 90. How do anticoagulants play a role in the care of trauma patients? A. They are used to treat head injuries. B. To prevent deep vein thrombosis, DVT. C. They accelerate wound healing. Or D. To control bleeding. The answer is B. To prevent deep vein thrombosis. 91. What is the primary concern in managing high-risk obstetric patients with cardiac disease? A. Controlling blood sugar levels. B. Monitoring and managing fluid balance. C. Ensuring uninterrupted sleep. Or D. Frequent fetal monitoring. The answer is B. Monitoring and managing fluid balance. 92. In pediatric patients, what is the key consideration in the administration of inotropes and vasopressors? A. They should be avoided. B. Using adult doses for effectiveness. C. Close monitoring for adverse effects. Or D. Administering them as a first-line treatment. The answer is C. Close monitoring for adverse effects. 93. What is the goal of early goal-directed therapy in trauma care? A. To rapidly achieve hemodynamic stability. B. To prepare the patient for surgery. C. To minimize the use of blood products. Or D. To assess long-term rehabilitation needs. The answer is A. To rapidly achieve hemodynamic stability. 94. For burn patients, why is the management of hypermetabolism important? A. To prevent weight gain. B. To reduce the risk of infection. C. To enhance wound healing and recovery. Or D. To manage pain more effectively. The answer is C. To enhance wound healing recovery. 95. In high-risk obstetric patients, what is the role of continuous ECG monitoring? A. To monitor the baby's heart rate. B. To assess the mother's cardiac function. C. To prepare for emergency interventions. Or D. To detect fetal distress. The answer is B. To assess the mother's cardiac function. 96. What is a key factor in the critical care of pediatric patients with respiratory failure? A. Avoiding oxygen therapy to prevent dependency. B. Using adult criteria for intubation. C. Tailoring ventilation strategies to age-specific physiology. Or D. Prioritizing oral medications over inhaled treatments. The answer is C. Tailoring ventilation strategies to age-specific physiology. 97. How does early mobilization benefit trauma patients in the ICU? A. It primarily provides psychological benefits. B. It helps in faster wound healing. C. It reduces the risk of hospital-acquired infections. Or D. It decreases the incidence of ICU-acquired weakness. The answer is D. It decreases the incidence of ICU-acquired weakness. 98. In managing high-risk obstetric patients, why is blood pressure control crucial? A. To prevent postpartum hemorrhage. B. To reduce the risk of stroke and other complications. C. To ensure fetal growth. Or D. To prepare for labor and delivery. The answer is B. To reduce the risk of stroke and other complications. 99. For pediatric patients in the ICU, what is the importance of involving child life specialists? A. To provide educational support. B. To assist with medical procedures. C. To support their development and emotional needs. Or D. To manage their medication schedules. The answer is C. To support their developmental and emotional needs. 100. What is the role of skin care in burn patient management? A. to provide cosmetic improvement, B, to prevent infections and promote healing, C, to reduce the need for pain medications, or D, to prepare for skin grafts. The answer is B, to prevent infections and promote healing. 101. In trauma patients, what is the primary goal of administering tetanus prophylaxis? A, to prevent wound infections, B, to reduce inflammation, C, to prevent tetanus infection, or D, to accelerate wound healing. The answer is C, to prevent tetanus infection. 102. What is the significance of lactate levels in the management of high-risk obstetric patients? A, they indicate the baby's health. B, they are a marker for maternal hydration status. C, they are used to monitor the effectiveness of pain management. Or D, they help assess the severity of hypoperfusion and tissue oxygenation. The answer is D. They help assess the severity of hypoperfusion and tissue oxygenation. 103. For pediatric patients in an adult ICU, how does the use of age-appropriate sedation and pain management differ from adults? A, pediatric patients require higher doses of sedatives. B, children are less sensitive to pain. C, dosages must be carefully adjusted based on weight and developmental level. Or D, sedation is typically not used in pediatric patients. The answer is C, dosages must be carefully adjusted based on weight and developmental levels. 104. In managing burn patients, why is the assessment of burn depth important? A, to determine the need for pain medication. B, to decide the appropriate method of wound closure. C, to assess the patient's overall health. Or D, to predict the length of hospital stay. The answer is B, to decide the appropriate method of wound closure. 105. How do rapid response teams impact the care of high-risk obstetric patients in the ICU? A, they provide psychological support. B, they ensure rapid intervention in case of emergencies. C, they manage the obstetric aspect of care. Or D, they are responsible for patient transport. The answer is B, they ensure rapid intervention in case of emergencies. 106. In trauma care, why is the assessment and management of pain crucial? A, to ensure patient comfort only. B, to facilitate rehabilitation. C, pain can be an indicator of undiagnosed injuries. Or D, to enable better sleep. The answer is C. Pain can be an indicator of undiagnosed injuries. 107. What role does family play in the care of pediatric patients in an adult ICU? A, they are primarily responsible for the child's daily care. B, their involvement is important for the child's emotional well-being. C, they make all the decisions regarding the patient's treatment. Or D, their presence is discouraged to minimize infection risk. The answer is B. Their involvement is important for the child's emotional well-being. 108. In high-risk obstetric patients, how does magnesium sulfate help in the management of preeclampsia? A, it stabilizes blood sugar levels. B, it acts as a tocolytic agent. C, it prevents seizures. Or D, it reduces blood pressure. The answer is C, it prevents seizures. 109. Why is nutritional support a critical aspect of burn care in the ICU? A, to prevent obesity. B, to satisfy patient hunger. C, to meet increased metabolic demands and promote wound healing. Or D, to improve taste sensation altered by medications. The answer is C, to meet increased metabolic demands and promote wound healing. 110. In trauma patients, what is the significance of secondary brain injury? A. It refers to injuries identified during the secondary survey. B. It is caused by complications like hypoxia and hypotension. C. It denotes psychological impact post-recovery. D. It is a term for recurrent head injuries. The answer is B. It is caused by complications like hypoxia and hypotension. 111. For high-risk obstetric patients, why is close monitoring of kidney function important? A. Kidney infections are common during pregnancy. B. Pregnancy can exacerbate underlying kidney conditions. C. Pregnancy-induced hypertension can impact kidney function. D. All pregnant women have a risk of kidney failure. The answer is C. Pregnancy-induced hypertension can impact kidney function. 112. What is the role of play in the care of pediatric patients in an adult ICU? A. It is used as a form of physical therapy. B. It provides a distraction from the ICU environment. C. It's a method for delivering medication. Or D. It is primarily for entertainment purposes. The answer is B. It provides a distraction from the ICU environment. 113. In burn patients, why is the risk of hypothermia a concern? A. Burn injuries make temperature regulation difficult. B. The ICU environment is typically cold. C. Patients often refuse blankets. Or D. It's a side effect of pain management. The answer is A. Burn injuries make temperature regulation difficult. 114. Why is the monitoring of uterine contractions important in high-risk obstetric patients? A. To assess the need for labor induction. B. To determine fetal distress. C. To predict the timing of delivery. And D. It indicates the effectiveness of tocolytic therapy. The answer is C. To predict the timing of delivery. 115. In pediatric trauma care, why is the management of fluid balance challenging? A. Children have a higher water content in their bodies. B. Children are less likely to express thirst. C. Their fluid requirements are drastically different from adults. D. They are more prone to dehydration. The answer is A. Children have a higher water content in their bodies. 116. For high-risk obstetric patients, what is the significance of frequent blood pressure monitoring? A. To check for medication side effects. B. It is a routine part of all ICU care. C. Hypertension can lead to complications like stroke. Or D. It helps in adjusting fluid intake. The answer is C. Hypertension can lead to complications like stroke. 117. In burn care, why is it important to assess and manage the patient's airway immediately? A. Burns can lead to airway obstruction and respiratory distress. B. It is a standard procedure for all ICU patients. C. To prepare for potential surgery. Or D. To assess the patient's ability to speak. The answer is A. Burns can lead to airway obstruction and respiratory distress. 118. How does the involvement of a multidisciplinary team benefit the care of pediatric patients in an adult ICU? A. It provides a variety of perspectives on treatment. B. It ensures that all aspects of the child's care are addressed. C. It reduces the workload on the nursing staff. And D. It is primarily for legal reasons. The answer is B. It ensures that all aspects of the child's care are addressed. 119. In trauma care, what is the purpose of serial examinations? A. To keep the patient engaged and alert. B. To monitor for changes and identify complications early. C. To determine the patient's pain tolerance. Or D. To assess the patient's memory over time. The answer is B, to monitor for changes and identify complications early. 120. For high-risk obstetric patients, why is the management of coagulation status important? A. Pregnancy increases the risk of bleeding disorders. B. To prepare for potential cesarean section. C. Coagulation disorders are common in ICU patients. D. It's a standard part of prenatal care. The answer is A. Pregnancy increases the risk of bleeding disorders. 121. In the management of pediatric patients in an adult ICU, what is the main concern with the use of mechanical ventilation? A. Risk of ventilator-associated lung injury. B. Difficulty in sedation management. C. The need for frequent ventilator adjustments. D. Increased risk of infection. The answer is A. Risk of ventilator-associated lung injury. 122. Why is continuous cardiac monitoring crucial in burn patients? A. To detect arrhythmias related to electrolyte imbalances. B. To monitor for signs of heart failure. C. To assess the effectiveness of pain management. D. As a standard procedure for all ICU patients. The answer is A. To detect arrhythmias related to electrolyte imbalances. 123. What is the significance of non-pharmacological pain management techniques in high-risk obstetric patients? A. They are the primary form of pain relief. B. They help reduce the use of medications that might affect the fetus. C. They are only used when pharmacological methods fail. D. They are used to assess the patient's pain tolerance. The answer is B. They help reduce the use of medications that might affect the fetus. 124. In trauma patients, what is the purpose of permissive hypotension in the initial treatment of hemorrhage? A. To maintain a lower blood pressure to reduce bleeding risk. B. To preserve fluid balance. C. To prepare for surgical intervention. D. To reduce the workload on the heart. The answer is A. To maintain a lower blood pressure to reduce bleeding risk. 125. How does early physical therapy impact the recovery of pediatric patients in an adult ICU? A. It helps in faster cognitive development. B. It primarily serves as a form of entertainment. C. It aids in the prevention of ICU-acquired weakness and promotes mobility. D. It is used to assess the child's response to treatment. The answer is C. It aids in the prevention of ICU-acquired weakness and promotes mobility. 126. In managing high-risk obstetric patients, why is the monitoring for signs of infection particularly important? A. Pregnant women have a naturally higher body temperature. B. Pregnancy alters immune system responses, increasing infection risk. C. Infections are common after any ICU admission. D. It's standard protocol for all ICU patients. The answer is B. Pregnancy alters immune system responses, increasing infection risk. 127. For burn patients, why is the management of the patient's environment important? A. To provide a pleasant aesthetic. B. To maintain temperature and humidity that support wound healing. C. To ensure the patient's privacy. Or D. To prevent disorientation and confusion. The answer is B. To maintain temperature and humidity that support wound healing. 128. In trauma care, why is the assessment of the cervical spine crucial? A. To prepare for potential surgery. B. It's a standard procedure for all trauma patients. C. To rule out spinal cord injury and prevent further harm. Or D. To determine the need for pain medication. The answer is C. to rule out spinal cord injury and prevent further harm. 129. What is the role of antenatal corticosteroids in the management of high-risk obstetric patients? A. To reduce maternal inflammation. B. To enhance fetal lung maturity in preterm labor. C. To control blood sugar levels. Or D. To manage pregnancy-induced hypertension. The answer is B. To enhance fetal lung maturity in preterm labor. 130. How does patient-centered care influence the treatment of pediatric patients in an adult ICU? A. It simplifies treatment decisions. B. It decreases the length of hospital stay. C. It improves the overall well-being and recovery of the patient. And D. Is primarily for the family's comfort. The answer is C. It improves the overall well-being and recovery of the child. 131. In burn patients, what is the importance of early rehabilitation interventions? A. To assess the patient's mental health. B. To prevent contractures and preserve range of motion. C. To prepare for discharge from the ICU. Or D. To reduce the need for pain medications. The answer is B. To prevent contractures and preserve range of motion. 132. Why is it important to monitor glucose levels in high-risk obstetric patients in the ICU? A. Pregnancy increases the risk of gestational diabetes. B. To adjust dietary plans. C. Glucose levels do not impact pregnancy outcomes. And D. It is a standard part of ICU monitoring. The answer is A. Pregnancy increases the risk of gestational diabetes. 133. In pediatric trauma care, why is the evaluation of growth and development crucial? A. To ensure normal physical growth. B. To assess the impact of trauma on development. C. To plan educational interventions. And D. It's a routine part of pediatric care. The answer is B. To assess the impact of trauma on development. 134. For trauma patients, what is the role of damage control resuscitation? A. To provide long-term rehabilitation. B. To manage chronic pain. C. To prioritize controlling bleeding and preventing coagulopathy. Or D. To prepare for elective surgeries. The answer is C. To prioritize controlling bleeding and preventing coagulopathy. 135. In high-risk obstetric patients, what is the primary concern with the onset of acute shortness of breath? A. Asthma. B. Anxiety or panic attack. C. Pulmonary embolism or amniotic fluid embolism. D. Common cold or respiratory infection. The answer is C. Pulmonary embolism or amniotic fluid embolism. 136. How does the presence of a child life specialist benefit pediatric patients in an adult ICU? A. They provide medical treatment. B. They help in managing the ICU schedule. C. They support child's emotional and developmental needs. And D. They assist in administering medications. The answer is C. They support the child's emotional and developmental needs. 137. In burn care, why is the assessment of nutritional status a priority? A. To ensure patient satisfaction with food. B. Burn injuries significantly increased metabolic demands. C. To prevent obesity during hospitalization. And D. It is a routine procedure in the ICU. The answer is B. Burn injuries significantly increase metabolic demands. 138. For trauma patients, what is the importance of tracheostomy in prolonged ventilation? A. It's mandatory procedure for all trauma patients. B. It provides a more secure airway and can improve patient comfort. C. It's solely for feeding purposes. D. To enhance the patient's appearance. The answer is B. It provides a more secure airway and can improve patient comfort. 139. In managing high-risk obstetric patients, what is the purpose of administering IV magnesium sulfate? A. To manage blood sugar levels. B. To treat hypertension. C. To prevent seizures in preeclampsia and eclampsia. D. As a nutritional supplement. The answer is C. To prevent seizures in preeclampsia and eclampsia. 140. What considerations are important for the psychological care of pediatric patients in an adult ICU? A. Prioritizing adult-focused entertainment. B. Using age-appropriate communication and activities. C. Limiting family visits to reduce stress. Or D. Focusing solely on medical treatment. The answer is B. Using age-appropriate communication and activities. 141. How does fluid management differ in pediatric burn patients compared to adults? A. Children require less fluids due to their smaller size. B. Fluid resuscitation formulas are based on body surface area, not age. C. Children are given fluids only orally. Or D. Pediatric patients do not require fluid resuscitation. The answer is B. Fluid resuscitation formulas are based on body surface area, not age. 142. In trauma patients, what is the importance of early antibiotic administration in open fractures? A. It is part of standard pain management. B. To enhance the healing of the fracture. C. To prevent infection. D. As a protocol for all fractures. The answer is C. To prevent infection. 143. For high-risk obstetric patients, why is the monitoring of liver enzymes important? A. To assess nutritional status. B. Liver function can be compromised in conditions like HELLP syndrome. C. It's a routine part of all ICU care. And D. To monitor the effects of medications. The answer is B. Liver function can be compromised in conditions like HELLP syndrome. 144. In the ICU, what is the role of developmental care in the treatment of pediatric patients? A. To ensure they keep up with their schoolwork. B. To maintain a routine similar to that of an adult ICU. C. To support their growth and developmental needs. And D. It is not a focus in the ICU. The answer is C. To support their growth and developmental needs. 145. What is the main goal of using bronchodilators in burn patients with inhalation injuries? A. To relieve anxiety. B. To manage pain. C. To improve respiratory function. And D. As a preventative measure for all burn patients. The answer is C. To improve respiratory function. 146. Why is it important to consider the psychosocial needs of high-risk obstetric patients in the ICU? A. It is a standard protocol for all patients. B. To ensure compliance with treatment. C. They may experience increased stress and anxiety related to their pregnancy. Or D. To keep the patient entertained. The answer is C. They may experience increased stress and anxiety related to their pregnancy. 147. In pediatric trauma care, what is the significance of using age-specific trauma scores? A. To predict long-term outcomes. B. They provide an accurate assessment of the severity of injuries. C. To determine the child's intelligence level. Or D. It is a legal requirement. The answer is B. They provide an accurate assessment of the severity of injuries. 148. How does enteral feeding benefit burn patients in the ICU? A. It is easier than parenteral nutrition. B. It provides a sense of normalcy. C. It maintains gut integrity and supports immune function. D. It is used only when the patient requests it. The answer is C. It maintains gut integrity and supports immune function. 149. For high-risk obstetric patients, why is it important to monitor urine output? A. It is an indicator of patient hydration. B. As a measure of kidney function and fluid balance. C. To check for the presence of urinary tract infections. D. It is part of standard ICU care for all patients. The answer is B. As a measure of kidney function and fluid balance. 150. In the ICU, why is the management of sleep important for pediatric patients? A. To adhere to hospital schedules. B. Sleep is essential for healing and development. C. To ensure they are awake for medical procedures. D. To synchronize with the adult ICU routines. The answer is B. Sleep is essential for healing and development.